Pero ngayon, Doc, papayagan na raw nila yung interzonal travel, no?
Yeah.
For those who are vaccinated. What do you think of this move? Is this, I mean, will we be able to manage that? Nakakapraning talaga yung mga surge, no? But because we know that vaccination does not really prevent transmission, and yet we're now saying that people can now engage in interzonal travel, that's what they call it, without undergoing an RT-PCR, but just presenting their proof of vaccination.
Well, that's coming from the thinking that if you're vaccinated and you've already gone beyond the 2-week interval post your second dose, that the likelihood of you actually transmitting the viral load that you might have, if you happen to be infected, will be lower than somebody who's not infected. And typically kasi, kung vaccinated ka, mas mild din yung symptoms. So yun yung theoretical, hypothetical basis nun. Kaya siya kino-consider. Siyempre medyo ano din, binabantayan ng husto yung datang yan. I guess in a way, yun, mga measured loosening, no, of restrictions, and then monitoring the data very carefully para kung sakasakalit makita natin na hindi pa natin kaya na ganun ang gawin, there's always the option naman, no, to try to rein it in and see how else to modify para naman mabalanse natin yung freedoms na pwede na natin ibigay dun sa mga bakunado at yung impact nun sa transmission.
Hindi ba dapat ikuno natin yung vaccination cards? Iba-iba eh. Pati yung mga ospital may kanya-kanyang vaccination card. Pati yung site.
Mamaya fake na yan, ano?
Ang dali-dali pa din. Yung LGU, LGU, from one LGU, iba-iba. Tapos kanya-kanya pa yung mga hospitals na mga form. Wala man lang mga secure.
That's right, no?
Mark,
Yes,
paano naman yun?
Right.
Yeah.
Yes, I agree. No, I think that's a really big challenge to the system that we have to have cards or parang a database that allows validation that people really were vaccinated.
Yes.
And already completed their 2 doses and are already 2 weeks beyond their last dose before we say that we allow them less restrictions, no? Tama, no? It's really a big concern. Iba-iba yun sa hospitals, iba-iba yun sa mga LGUs, and DICT is the one that's tasked, no, to actually work on this. And from what I understand, they already have a system in place, and they're asking the LGUs actually to upload the data into their system so that kahit iba-iba yung cards, at least meron kang pwedeng puntahan na database para ma-validate kung tama nga ba yung information na pinapresent nung traveler or nung tao na nagpe-presenta ng card.